How you doing?
How you doing? A busy day
Good.
in the city of Brampton.
Yeah, I'm sure it's a busy day in the city of Brampton every day for you.
Yeah, today
So,
this afternoon I have the Big City Mayors Conference. We have a minister with a meeting of infrastructure. There's a domestic violence conference. There's a city council meeting, a Hindu Heritage Month flag raising, and of course, best of all, a conversation with Khaled.
okay, well, thank you very much. So I did see Theodore was helping you with your stretches. I saw that
Yeah,
on Instagram. So
yeah. You
it's
know,
pretty
at a year and a half, you can start to be a big help. We
cool.
tried
Yeah.
to teach him how to help us rake the leaves. But
Okay.
it turned out he was enjoying jumping in the pile of leaves that we were raking rather than actually moving them. We got him his own little rake.
Okay, nice. Okay, that's next year, yeah, for sure. So, a lot of questions to get at. Peel, 10.1% positivity rate, higher than Toronto and higher than a lot of cities in Europe that have already imposed lockdowns. Do you see a further lockdown or just a lockdown coming in general in Peel and Toronto?
Well, first let me speak about the positivity rate. Um, there was a jump in the positivity rate when we changed the testing criteria. And so
Okay.
before, anyone that wanted to get tested could get tested. Now you're only supposed to get tested if you have COVID symptoms. So that also means that other people who think they have COVID, 90% don't. And so a 10% positivity rate is an increase from where we were before, but that changed with the testing criteria changing. And so if you look at the positivity rate in some places, like Florida, they don't do as much testing, and so it's not as accurate. I think because we do a lot of testing in Canada, we have a more accurate glimpse of what of where the virus is. And I'd also note that's not to diminish that we don't have real threats with the second wave. The numbers are spiking. It is present in Brampton and Peel region. We know with so many essential workers that we face a greater threat. It's why we were pushing so hard for the isolation center. It's why we're saying that that Peel region needs supports because we're in the midst of this fight with COVID-19.
Now, is there going to be a lockdown, do you think?
So no, there's not going to be a complete lockdown because Canada couldn't function if you had a complete lockdown. And let me say why. Even in March, when everything was shut down, they didn't shut down Peel region. They didn't lock down Peel region. Do you know why? Well, if you look at our largest companies, food processing, transportation, logistics, they were considered essential workers. They are never shut down. We have 11,000 people in transportation logistics. Look at the trucking companies. Look at Amazon. Look at the food processing companies. If they didn't function, you wouldn't have food on the grocery shelves. If they did not function, Canada's supply chain would not exist. And so there's no lockdown scenario where they lock down our workforce because Canada, not Brampton, Canada could not function without Brampton's essential workers.
And I believe Amazon's there too, right? The biggest warehouse in Canada.
Yeah.
So, yeah. This color tiered COVID-19 system, I'm going to be brutally honest, I think is very confusing. And I've gotten, dozens and dozens of messages asking me what the red alert meant. Do you know how long this red alert time frame will be? Will it be for 14 days? Is it going to be for 28 days? Because from what I've read, it said 28 days once it gets into a new color system.
It's changed so many times that in terms of the provincial framework, your guess is as good as mine if it will be changed again. And the premier said he's listening to the advice of his provincial emergency team, and so as they change the framework, he adapts. And frankly, the virus adapts too, right? So you have to adapt with the virus. As the virus grows, as it spreads, spread would be a more appropriate word. I think you'll have to see increased adaptations. What I would say is we know a lot more about the virus now. In March, when they were having shutdowns, they were less surgical. And I think because we know where the virus moves, what is a greater risk and what is a more minimal risk, the changes can be more targeted and more surgical.
Okay. So I know we're in between kind of, when Doug Ford's presser is and we're talking. So I think a lot might change within the next half an hour or so. What else does Peel Region have to do to kind of stop the spread of COVID-19?
So we need that isolation center for our most precarious workers. That's coming December 1st. We got the approval. I'm trying to push the Minister of Health federally to let us have it earlier, maybe November 15th, like tomorrow if we could have it. I want it as soon as possible because we know household spread is caused by people in crowded living conditions who can't afford to self-isolate, and we need to make sure we have the back of our essential workers. And so that's what I'm focused on. The number one source of transmission in Peel Region is industrial settings. So let's focus on where the transmission is coming from, have their back, have their support, and that's why I'm continuing to push to have that isolation center up and operational as soon as possible.
And sorry, what does this isolation center look like? Is it a hotel that's going to become an isolation?
So it's a hotel that's seconded by Peel Public Health and the federal government. I heard some crazy stuff on the internet where people are saying, "Oh, there's fences around it and guards." No, it's voluntary. Because some people can't afford to rent a hotel room for 14 days to isolate, and you don't want to put your family at risk. You don't want to put your friends at risk, and so they offer you a hotel room where you can safely isolate and not spread the virus. And the reality is, a lot of the COVID cases, you don't have to go into the hospital. And so if you're one of those COVID cases where you can weather it without having to go to the hospital, you can do so in an isolation center.
I know you've been a huge advocate for restaurants in Brampton. What do you have to say to the restaurants that are saying that, it's actually a safer spot to drink and, have food than to, go home and have a party at a condo or a house and not have any COVID-19 protocols?
Well, I agree with them. And actually, Dr. Bonnie Henry, the medical officer of health for British Columbia, has actually been on the record saying that. I haven't had a single case of COVID transmission in a restaurant in Brampton. It's why I was pushing the Premier, saying that we don't need additional restrictions on areas of our local economy that don't contribute to the spread. Because of the precautions restaurants were taking, because they were making sure people had masks, ensuring physical distancing, proper sanitization practices, it was safer. And so now my worry is you have a lot of meetings that might have happened in a restaurant that now happen in private settings where they don't adhere to the public health guidelines. And so I do believe that we need to be more surgical, and restrictions on restaurants, we're not surgical. They were broad-based and sweeping, and we need to focus more on where the virus is actually spreading.
You're on TV with, you've been on TV with Bonnie Crombie, the mayor of Mississauga, a lot. In one of the interviews, I saw her say that she heard that school Christmas vacations might be starting earlier. Do you know anything about that?
So I haven't heard that. There's rumors like that are out there, but that would be a provincial decision, and it's not one they've asked us for municipal input on. Okay.
Dr. Lowe also suggested banning private gatherings, social gatherings inside houses. If this kind of bylaw is passed, how is enforcement going to happen?
So it's not possible for bylaw to go to every house. This is a request to public health. It's a request to put your family and your friends' safety in mind, their health in mind. We're asking people to do the right thing. It's not going to be something that a bylaw officer is going to show up at your door and give you a ticket, but we can't have household mixing right now. The virus spreads too fast when you have broad-based household mixing. And so particularly with Diwali and Bandi Chor Divas, I need people to be really careful. Normally this is a time when you have large gatherings and celebrations. We had a Thanksgiving spike. We had a Halloween spike. We can't afford another spike. So please, everyone, be careful.
My last question was about Diwali. This weekend is Diwali. Is there going to be more enforcement out to, to watch out for public gatherings?
Yeah, I would say it's more education than strict enforcement, but we will have bylaw and police out there reminding people that gatherings are not permitted right now. So we don't want to see Diwali parties or Bandi Chor Divas celebrations. It's not appropriate. Our physician, our top physician, has said it's dangerous right now. And so we hope people will take the advice of public health to heart.
Okay. And last question, what do you think Doug Ford, the Premier, is going to say today?
I don't think there's any major announcements coming today. We certainly haven't been consulted on any major announcements. So we'll see. Sometimes press conferences can be surprising, but I don't anticipate any significant new changes today.
And last thing, Takeout Wednesday. What'd you eat this week?
So this week, on Wednesday, what did we have? I think our takeout this week was Vesuvio's, but I think we had something else. And of course, we are regulars at Nova Grill.
Okay, perfect. All right, Mayor Brown, thank you so much.
Thank you.
Have a good weekend.